Hello, and welcome to another NABBW Financial Podcast. Today, I'm with frequent guest Pam Sams to discuss our October topic, Medicare Update. We'll be reviewing the basics as well as sharing important changes for Medicare for 2022. Medicare, of course, is the primary health insurance for most Americans aged 65 and older. As Pam will shortly be reviewing for us, Medicare open enrollment has already started, and between now and December 7th, all of the more than 63 million Medicare beneficiaries can pick a new Medicare Part D drug plan, a new Medicare Advantage plan, or switch from original Medicare into a Medicare Advantage plan or vice versa. Any coverage changes made during this period will go into effect January 1st, 2022. I know personally for me, I've been really happy with my Part D, and then they told me that they're going to make more things $0 per month, but they're going to double my monthly fee. So now I have to figure out if it's still the best plan.
Exactly.
All right. But despite the flurry of ads and public service announcements we're seeing on TV and receiving in the mail, most Medicare beneficiaries are probably thinking of sticking with the coverage they've already had. After all, this just seems easier. And I know the first year that I had to pick this, I didn't make the best choices. And then I got it better the next year. And there's just this ease, I think, Pam, of saying, oh, it's okay, I'll just stick with it. But I think you will tell us that this is a missed opportunity because, well, it can be tedious to go over our insurance coverages. The effort can pay off, hopefully, in lower costs. Each year, Medicare plans are allowed to make changes that could potentially increase your out-of-pocket outlay. And even if your coverage didn't change, your needs might be different than they were last year. For example, you might have gotten a new medical diagnosis that results in new medications and a specialist visits that might be better covered under a different plan. So I really think Pam is going to tell you the same thing that I think is, as much as I don't want to do it, I really need to go through all the stuff that everybody's sending me and make sure I'm happy with my choices or make changes if I need to. But I'm getting a little bit ahead of myself here. Before we dive into Medicare basics and changes, let me backtrack and properly introduce this call. Hi, I'm Ann Holmes, your moderator and the Boomer-in-Chief of the National Association of Baby Boomer Women, an organization dedicated to educating and empowering women at midlife and beyond. And with me to help us make the best possible Medicare decisions is Pamela J. Sams, BFA, CRPC, MBA, and her newest situation is Trusted Advisor to Professional Women, which I think sounds pretty darn impressive. Pam is a Chartered Retirement Planning Counselor and NABBW's Retirement Planning Associate. An expert in personal finance, she is president of Jackson Sams Wealth Strategies in Herndon, Virginia, and a frequent guest who covers important information related to money and financial planning. So welcome everyone to our Zoom call, and welcome to you, Pam. We're glad that we're all here together for this important and informative call. But before we can launch into the discussion today, I need to play a quick audio clip just to keep us properly legal.
Securities offered through Securities America Incorporated, a registered broker-dealer, member FINRA SIPC. Advisory services offered through Securities America Advisors Incorporated, a SEC registered investment advisory firm. Pamela Sams, investment advisor representative. Jackson Sams Wealth Strategies, Securities America Incorporated, and all other entities named are separate entities.
Thanks for joining us again this month, Pam.
Yes, thanks for having me once again. And this is kind of the time where everybody, like you said before in your intro, everybody's mailbox is inundated with Medicare information, and every other commercial that you see on TV is a Medicare Advantage commercial. So I'm sure that you're probably not well versed, but probably inundated with a lot of information as it comes to Medicare. But you know, if you want to make a change, or if you've aged into Medicare during this time period, it can be so overwhelming and so confusing because you turn 65 and then nobody really gives you the roadmap on how to make a decision when it comes to Medicare. And then you have that short period of time to really make a change or make or enroll in a program. after between the October and December. So it's a short time frame. You got a lot of information to digest. So really just kind of getting into talking a little bit about what types of things that you need to know about it. Number one, what Medicare is, and then some of the options that you do have.
It's an excellent review that you're going to be providing for us here, Pam, whether people are starting that first time through figuring it all out, or if you're reviewing it annually. And there's part A, B, there's different parts. So we're going to start with the first question is, what is Medicare? And then we'll get into some of those parts. So
Exactly.
let's
Yeah.
begin with what is Medicare and who's eligible?
Exactly. So I always call it the ABCDs of Medicare because there's all of these moving parts to that. But before I get into kind of what Medicare is and what does it cover, statistically, I believe Principal Group did a survey a couple of years ago. This one's dated 2019. The retirees' top concerns are reduced medical benefits. How are they going to cover medical benefits after retirement? That is the number one top concern for retirees. So Medicare is one of those areas that you would be covered in the event that after you've retired, because most people aren't able to take their employee plan with them. A lot of, let's say, pension organizations that cover pensions, like federal government or maybe teachers and things like that, may have access to a health plan. But for the most part, most Americans will age into Medicare. And that's really where you look at the federal health insurance program. That's what Medicare is. It is for people that are age 65 and older, and or if you're disabled for at least 2 years, you do have access to Medicare as well. Now, Medicare is also, there's three main parts to Medicare. There's Part A, Part B, Part C. Those are three main parts. And then you also have a prescription drug coverage, which is Part D. And generally, most people will get either a Medigap, it's called Medicare Supplement now, to supplement what Medicare does not cover, because Medicare covers about 80% of your cost for medical care. And then the other 20% is co-insurance that you are basically responsible for. So that's what a lot of people get, either Medicare Supplement or basically the old term Medigap plan, in order to cover that 20%. So you're not out of pocket for that. Again, like I said, the eligibility is age 65 or older. That's when you age into Medicare, and or you're disabled for at least 2 years. Now, to qualify for Medicare, you do also have to, you must qualify for Social Security benefits, or elected or not to. Not to say that you need to start taking Social Security at the same time that you want to start Medicare. It's just that's how Part A is covered. And we'll talk a little bit about that in a minute. Is that you must be eligible or paid into the federal insurance program system through your FICA taxes. That's why the Social Security benefits come into play, is that through your payroll throughout your career, they've taken a little bit of money and put it into basically the pot for your Medicare benefits. That's why your Part A is going to be free. You may be eligible also based on your spouse's and or former spouse's eligibility. So if you haven't worked at all, but you are married, or let's say you're a stay-at-home, for some period of time, you could qualify for Medicare benefits under your spouse's and or former spouse's eligibility. That's where that would come in. So that's how you become eligible for Medicare, age 65 and or disabled for at least 2 years. You must have either qualified for Social Security through the FICA tax, and or you can have it provided on your spouse's or former spouse's record.
So you've alluded to different parts. Should we go over the different parts right now, or in general, and then go into them specifically?
Yes, let's do that.
Okay, all right.
So Medicare is devised of Part A and B. So if you were to And it's also called the Original Medicare. We'll get a little bit into the Advantage plan because that's what a lot of the commercials you're seeing now
Mhm.
are related to Medicare Advantage. But the Part A, Medicare Part A is the what they call Original Medicare. Part A is going to cover your hospital insurance. So that's going to be hospital, your hospital stays, skilled nursing care up to 100 days, and then you also have home health and then a house or hospice care would be covered under the Part A. As I alluded before in a previous slide, Part A is free to those who have paid into the system. So
Mhm.
throughout your career, through your payroll, you had the FICA tax, and that was set aside to cover the what they call the entitlement program, which would be the federal healthcare insurance program, which is Medicare. Part A is provided to you for free, so you don't have to pay for that. Part B is your doctors. That's your medical insurance, just like you would do now. Go to the doctor, pay a copay, doctor services. So Part B all has to do with the doctor services, any outpatient or medical or surgical services, diagnostic tests, and also any outpatient therapy would be
Mhm.
covered under your Part B as well. Now in Part A, there's going to be what they call a hospital stay deductible. It changes each year. So roughly now it's at about 48. It changes from year to year. So you definitely want to confirm the numbers. But it's about $1,400 per benefit period for your deductible. So if you go to the hospital, you do have to pay that hospital stay deductible for your Part A under Medicare. You pay before Medicare pays anything. You can pay this several times throughout the year. That particular deductible covers you for 60 days at a time, and then it starts over all again. So if you went to the hospital and you had one occurrence, you got out, it's longer than 60 days, then you go back into the hospital again for something different, then you also have to pay the hospital stay deductible again. So you could end up having that several times throughout the year, depending on how often you go to the hospital or have these hospital stays. That's why that Medicare supplement comes into play in order to cover some of the out-of-pocket expenses that you may have as it
Mhm.
relates to that hospital stay deductible. Medicare Part B is going to have a premium to it, somewhere at about 200, 250 per year on the Part D. I'm sorry, Part B Medicare deductible. The co-insurance, like I said before, 20% of all charges will you incur, and then Medicare pays the 80% for that. Um, so that's what the Part B is going to cover for you, would be your doctors, but you also have a deductible for that. Part B has a premium attached to it. So that is based on what your adjusted gross income is per year. So for 2022, in order to determine your Part B premium, they're looking at your 2020 tax return.
Mhm.
So if you filed your 2020 tax return last year, that's where that number that they're using to calculate what your Part B premium would be for 2022. And it's like I said, it's based on your adjusted gross income. So if it's a little bit higher number, your premium's going to be a little bit higher for your Part B premium. If it's a lower number, then it'll be a little bit lower. The tables for your Medicare Part B premium is generally at medicare.gov. You can take a look at where you fall. It'll have it just like the tax table. It'll say,
Mhm.
where you are with um, a certain income level from this income to this income. This is how much your Part B premium is going to be. And then if you make a little bit more, it is what they call adjusted related term. It's called IRMA, basically. So modified adjusted gross income. You may have a little bit of a more of a premium for that based on your income. So that's how they're going to price your Part B premium. Your A is for free because you've paid into it. Well, technically it's not for free because you've been paying
Mhm.
into it all along through your paycheck. And then Part B premium is going to be based on your adjusted gross income for each year. So as you go along in retirement, depending on your distributions from, let's say, retirement plans or IRAs, that's what would be would go in for income, and that's how they're going to determine your Part B premium. So in any given year, you can manipulate what that premium is going to be. If in the beginning of your when you first retire, your salary was a little bit higher, or you had an anomaly in your income, let's say you sold property or you have increase in income in that particular year, you can basically kind of go to bat for yourself and say, hey, that was kind of an anomaly year. My income is generally not going to be that high. Then you can basically adjust or at least plead your case, so to speak, to see if you can bring those premiums down a little bit for your Part B.
Okay. Is there anything more that we should cover about Part A or Part B, or should we move on to Part C?
Yep. Let's go ahead and on to Part C.
Okay. Part C, I think, is what you said is called Medicare Advantage.
Correct. Yeah. So if in a normal situation or a situation where there is original Medicare, it will be Part A, Part B, and then your prescription drug. So it's going to be a little bit out of sync in terms of kind of the alphabet soup of things. So you have A, B, and D with original Medicare. But if you want to do Medicare Advantage, and that's why I said that you get a lot of information from carriers during this time of the year in your inbox and the commercials, really focus on Medicare Advantage, which is, think of it as the bundled version of original Medicare, where original Medicare was kind of the a la carte. You have your Part A and then your B, and then you pick up a Part D prescription drug program. That's kind of the a la carte version. Think of it Medicare Advantage Part C as your bundled version. So it's just like if you were thinking about your cable and you have all of your channels together in a bundled package, or you have your internet, you have your phone, you have your TV all in one. This is similar to that, but in the healthcare insurance situation. So with Advantage, the coverage is provided by a private insurance company, just like you have now. So if you have, let's say, Aetna or Blue Cross Blue Shield or any of those carriers, they would be able to provide the Medicare plan for you under the Advantage plan. So you're going to get all coverage in Part A, Part B, and Part D all in one bundle. You also get the benefits that through that to help cover other costs, because a lot of the plans may cover, let's say, Silver Snickers, which is a healthcare plan, vision. They're talking about putting dental on. I believe that's one of the things that that's still in flux, but hopefully they're at a dental plan. But some of the niceties that they put, like just like what you have in your current carrier insurance programs, they would be able to provide under a Medicare Advantage plan. So think of it as a bundled with that. What you're doing there is that the private insurance company is going to charge you a premium for the plan, but you still have to pay. You're not going to ever get out of paying Part B premium. You're still going to pay a Part B premium, and you're going to pay whatever the insurance company is going to charge you for the Advantage plan. And you don't have to pay for your drug prescription because it's all encompassing inside of the bundled plan. You may have to pay a little bit of co-pays depending on what your medication looks like. But for the most part, when you're dealing with your Advantage plan, you're going to pay the premium for what the insurance company is going to charge you to provide the plan. And then you still have the Part B premium that you pay basically to the federal government. Think of Advantage as a private insurance company basically providing the original Medicare to you as an intermediary for that. So you're still going to pay the Part B premium.
Okay, now I'm going to say that if it's a private insurance company, then I tend to think of that they need to be a for-profit organization, whereas Part A coming from the federal government, it's not necessarily looking for profit. So what would you say is the advantages of having a Part C as opposed to the A and B.
Mm-hmm. It just makes it a little simpler, so you're not going to have all of these different, cards that you have to
Mhm.
go through. So, a lot of times you will have your Medicare card. So you'll have A that you have to deal with, B that you have to deal with, and then you have to get a supplemental Part D plan. So it's just disjointed because it's more a la carte. People want something nice and easy and simple, like what you may currently have right now with your employer provided plan. This is a way to keep that same system intact while giving an advantage plan. And what happened, these are fairly new plans. I wouldn't say as new, but several years into having advantage plans, is that the private insurance company said, hey, we've been doing this all along, federal government. We can administer this program a lot better.
Mhm.
These are what we provide for you. And then that's how advantage came to be, because they're already doing it. They went to the federal government and said, look, we can administer the plan a little bit better. We'll still keep your Part B intact because that's what you would charge there, but we can do this on a bundled version versus kind of having the a la carte
Mhm.
Medicare plan.
All right. So I don't have any more questions about that right now. Let's talk about Part D.
Yes, now Part D is your prescription drug plan. That's going to help cover your prescription drug costs. They also are provided through private insurance companies. Part D is the federal health insurance plan is never going to cover a Part D. They will always tell you you need to provide that through a private insurance company. So, the Aetnas of the world and Humanas and all of those,
Mhm.
you would get what we call, if you do the original Medicare version, the Part A for free, the Part B that you would pay for premium, and then you would get what they call a standalone Part D prescription drug program. If you have the bundled version through Medicare Advantage, then D would be covered in that bundle version of it. This is what they call voluntary enrollment, not really voluntary, because at some point, if you end up not signing up for a prescription drug plan when you were eligible to sign up for a prescription drug plan, there could be some penalties. And the penalties is basically an ongoing uh, penalty. So if
Mhm.
you don't pay it, you end up paying a little bit more for your drug plan throughout the life if you have a prescription drug plan. So you want to do that in the time period that you are eligible to enroll. You must be enrolled in Part A and B in order to get D. Same thing with Advantage plan. If it's bundled in there, you have to be eligible for Part A and B to get a prescription Part D program. You enroll during what we call the initial enrollment period, that you either age into Medicare,
Mhm.
and then you have that window to sign up for Part D, and or you can make some adjustments and changes, as you had alluded before in the beginning of the call, during this open enrollment season, to basically change a prescription program or add on a prescription program or change into a Medicare Advantage bundle plan. So those are some of the things that you need to have with prescriptions. Like I said, you can get a standalone drug plan, or you can get it as part of the Medicare Advantage plan. The thing about your prescription drug program is that they all have formularies. And what that
Mhm.
is basically a list of drugs that are covered under your plan. So make sure your drugs are on the formulary. I see this a lot of times, is where you go and you look at and review the Part D plans, but then for some reason you didn't double check the formulary. You go to the pharmacy in January, and the next thing you know, it's full cost, and you're like, well, my health plan should have covered that, but something happened and it's not on your formulary any longer. So I always stress to people to do your research. You should review your plan every year, because formularies change from year to year.
Mhm.
I got, maybe 2 weeks ago from Aetna as my plan, is that there were certain things that were coming off, there were certain things that were coming on. They are by law have to send you the updates on the formulary on that. So just don't toss them when they come in the mail. Just take a look at it. A lot of them aren't doing the mailing anymore, but you want to go on the website just to double check when you're looking for a Part D plan, is to review your list, make a list of the drugs that you're currently taking or the prescriptions that you currently have, and then match it against the formularies of the providers that you are evaluating, because that's key. Because you don't want a nasty surprise in January when you were used to a 20 or $5, $10, $20 copay, and then all of a sudden now you have a $250, $300 bill. You don't want that. So you want to make sure you check the formulary with your Part D premium.
Now, my experience with the formulary is that sometimes, there might be a specific drug that you're taking, but you have to make sure it's the details of the drug are still covered, because they might have, 3 or 4 flavors of that particular drug. And,
Exactly.
you need to make sure that the one that you're taking is the one that's on the list. Otherwise, you'll have that nasty surprise when.
Yeah, exactly. And then some, become either what they call specialized tier 5 or tier 4s and 5s, which tend to be a little bit more pricier. And some of these carriers don't want to, because the cost of the drug is so much. Sometimes they may drop some of these tier 4 or 5. If that's the case, you can always basically make the case to your doctor to see if there's another version of it, or a generic version of it, or something similar, what they call step therapy on that, in order to, if they eliminated the tier 4 or 5 of that particular prescription, then just work with your doctor to see if there's something that could be a substitute. And then of course they go to the step therapy to make sure that is your system is gonna be okay with the new prescription before they make a final switch on that.
Right. I know I was looking at the changes that were coming for mine, and it was telling me that, I told you that the monthly was gonna double, but they were telling me that now tier 1 and 2, which had been $0 per month, were still $0 per month, but now they were adding three, and I think 6, and I was going, 6? I didn't even know there was a tier 6.
I didn't exactly. That must be something definitely new, because I'm not aware of a tier 6 either. I know the tier 4s and 5s generally be basically the specialty drugs is what they call them.
Yeah, I thought, well, that must be some really specialty.
Yeah, that must be some really specialty experimental stuff at tier 6.
Yes. Yep. So I figured, since my drugs haven't changed, that probably I don't need to worry about that now they're covering tier 6. But it was just like, that came out of the blue. I didn't know there was a tier 6.
Yeah, I know. I'm gonna have to go back and look at my formulary now to see.
Well, or maybe they just made it up on mine to make me think that I'm getting more.
Yeah, exactly. That definitely sounds like that's the case.
I won't say who. I won't say who the company is.
I gotcha. Yeah, because I've never seen the tier 6, but yeah, I may have to do a little research on my part as well.
Okay. All right. So Medicare supplements. You've alluded to that earlier, but let's talk more about them.
Yes, and this is the supplement. You may have heard, like I said, being called Medigap plans, Medicare supplement. This is something that you would get. Now, just kind of step back a little bit. If you get Medicare Advantage plan, you will not be eligible to get a Medicare supplement plan. It's either one or the other.
Okay.
That's what you cover. And then if you try to sign up for both, one will cancel out from there. So this is if you are going to go with an a la carte original Medicare plan, the A, the B, the D parts of your Medicare, and then you would add a supplement. If you're going to go with Medicare Advantage Part C, the supplement is out of the picture. You don't need to worry about it. But if you're going to go with the Medicare supplement plan, you have the private. This is also offered through a private insurance company. The premiums are going to vary by company, coverage, and state as well. They're generally not going to cover long-term care, dental, hearing aids, private duty nurses. Some of them are reevaluating some of those things. Like I said, dental was one of those coverages that, why wouldn't you cover dental?
Mhm.
Most people who retire or retirees, we still need to take care of our teeth.
Right.
So they're still looking at bringing that on board as a benefit through the regular Medicare program and or supplement. So look out for that. You do need to buy within a 6-month period of being initially eligible for Medicare if you're going to get a Medicare supplement plan. This is the only time that you are allowed to get it without underwriting. It's
Mhm.
basically a guaranteed renewable issue um, Medicare supplement plan, even if you have health problems. But if you wait after that 6 month period, you could be subject to underwriting and you may not be eligible for it. So if you think you want a Medicare supplement plan, definitely apply for it during the time period where it is the guaranteed issue plan within that 6 months of it becoming eligible for Medicare. After that, if you have any health issues, it could be subject to underwriter and you could not be underwritten for a Medicare supplement policy. So definitely make sure you take a look at the dates on the enrollment period. They're generally standardized plans all the way from A, B, what they call Plan A, B, C, D. I think F went away, but they
Mhm.
have them, basically the whole alphabet soup. So this is different than Part A, Part B, Part D, Part C. These are called supplement plans are called Plan A, Plan B. I know it's all confusing,
Mhm.
but Plan A, B, G would be that. Plans do cover costs like I was explaining before, the co-payments, the co-insurance, the
Mhm.
deductibles, the hospital state deductibles, anything that Medicare is not going to cover could be covered through a Medicare supplement plan. Now, all standardized plans must offer the same benefits across the country. So if you get a Medicare uh, supplement plan, let's say G, it's going to be the same benefits that you would get in your region and in my region. So it's going to be a standardized plan. The cost is usually the only differences between the policies. So G would cover something different than L and M and N. So you have
Mhm.
to take a look at that. Some states, I know at one point, Massachusetts, Wisconsin, and Minnesota are standardized in a different way. I don't know why those particular 3 states, but they had a little bit different standardized plans in those
Mhm.
particular states. But for the most part, you take a look at what you want to have coverage. The keys that I see in the Medicare supplement plan is if I'm traveling or if I'm traveling overseas, kind of, just like with your premium and your Medicare, you can have kind of the Cadillac model of it, or you can
Mhm.
have like a little bit lower version of it. That's going to depend on what the premium is going to be as well. So if you go with, let's say, Plan G, which is generally kind of all of the benefits that are available, versus an A, then that would be a difference on what you're going to pay for premium as well for that.
Okay. You said traveling. That makes me think of an off the wall kind of a question, but maybe
Mhm,
maybe it's a, a question people might wonder. I have never considered Medicare medical tourism, but I know that
mhm,
there are people that have gone to Mexico or
mhm.
to other maybe Caribbean countries or maybe Europe, maybe not Europe, for certain surgeries that they might need
Yeah.
because the cost is less there. Now, if you have Medicare, will the Medicare cover when you're out of the country like that? Or is that something that you're just on your own paying out of your own pocket when you go to these other places?
Yeah, for the most part, those are going to be paid out of pocket. For if you're thinking about kind of Medicare supplement as it relates to travel, this is for like an emergency situation. So if
And
you're
that's
in
what I thought you
Europe,
meant, like you're
yeah,
in Europe and
exactly.
in
Yeah,
and you break your leg or something like
yeah.
that, you know.
Yeah. And then the supplement will pick it up there. This is not kind of elective surgeries to go with like you said, medical tourism,
Mhm.
so to speak.
Right.
So you would have to pay out of pocket for that. This is for emergency situations if you're traveling outside of the U.S. For that, you break your leg or you do something that would require medical attention,
Mhm.
then the Medicare supplement plan, depending on which one you get, if that's something that you do and you do a lot of traveling, make sure you get a supplement plan that would cover that. Same thing with any other co-pays and insurances. So, like I said, the top of the line Medicare supplement plan is generally G. I think F went away some time ago. But you can take a look at, they have, again, Medicare.gov has a chart on the Medicare supplement plans at, from A basically to N. And then you can just see what the benefits are that are covered under those particular ones. And then that's where you would go to a private insurance company to see which one that you want to get. So,
Mhm.
if you want Blue Cross Blue Shield, or if you want Humana, whatever, all of them have a supplement plan. You just need to see which carrier you want to go with after you figure out which plan that you want.
All right. Now I've got one question that
Mhm.
people might be wondering if they've had Medicare already. In the past, there was something that we talked about called the donut hole, and I don't see that on our list to discuss this year. So does that
Uh-huh.
mean we finally got rid of the donut hole?
Yeah, I think it's enough to not have to deal with, because they were trying to close the donut hole
Mhm.
within the 22-23 period. So I mean, I took it off because I don't think it's going to be much of an impact this
Oh,
year for
that's
most
wonderful.
people
Mhm.
to deal with. But yeah, it may be a small gap, but nothing major like
Mhm.
before where we had the tasty donut hole
Right.
examples.
Right. Yes. Okay, well, let's talk a little bit more about cost. You've said already that it varies by area. So what else do we need to know about cost here?
Yeah, it's really taking a look at what your plans are. So with your Medicare supplement, you want to look at co-pays and deductibles that are going to be under your Part A for your hospital stay deductibles, and your B, like I said before, it's really looking at what do you want it to cover. You can go all the way from kind of the minimum part of
Mhm.
a supplement plan where they would cover, let's say the hospital stay deductible or your Part B premiums, or some of the other co-insurance, all the way into kind of the top of the line to cover the travel, the U.S. out of the U.S. travel, things like that.
Mhm.
So that's going to depend on kind of the version that you want. Kind of, just like when you go and buy a car, and you have
Mhm.
the sticker price, and then after you've added all of the amenities that they
Right.
tell you, you want the sunroof, you want all of that,
Mhm.
then that's kind of how you're going to determine what your cost is going to be for your Medicare supplement plan initially. Now, it does creep up on you as you age, and it is also regional.
Mhm.
So, I'm in the DC metro area. Plans may be a little bit more in my region versus somewhere else. They have to be a standardized plan, as I mentioned before, but the premiums could be a little bit more depending on your region, your age, and then kind of what plan or version that you want, all the way from kind of the basics, all the way kind of to the more um, Cadillac version
Mhm.
of your plan. So those are kind of some things to consider when you're thinking about the cost of a supplement plan. Remember, if you're going to do the supplement, you're gonna be under the original Medicare, the a la carte version. The A, you have to consider your Part B premium, and then what your supplement's going to be. So in that situation, you'll probably have Part B premium, and then your Medicare supplement costs
Mhm.
as well, and your prescription drug, because you do need to add that on. So that's why I was saying sometimes people with Advantage want to just have one particular bill, maybe two, because you have to
Mhm.
work with your Part B premium and just the insurance cost for the premium for the plan versus I need to pay B premium, D premium, supplement premium if you're doing the original a la
Mhm.
carte Medicare version of it. So
Okay.
those are some of the things to think about when you're thinking about the cost of certain things. So if you're thinking about original Medicare, Part A, like I said, it's going to be a zero premium. Generally, your Part B is going to be somewhere between $200-300, depending on your adjusted gross income. That could be a little bit higher. Your Part D premium on average is we're going to run you nationally probably about $35 to $40. And then you have a supplement plan, generally about $200 to $300. That's a national average, so
Mhm.
don't quote me on it, but it's a national average that I'm using. So in that particular instance, your monthly premium could be about let's say $450 to $500 a month for the original Medicare cost. Now, if you were to convert that to a Medicare Advantage plan, you have basically the Part A is going to be for free for you. If you've paid into your Social Security tax with FICA, then you have your Part B premium, generally about $200, $250 a month, like I said before, and then you'll just have an additional plan premium for your Advantage. Average is about $30-40. So that could end up being closer to $200 a month for your premiums versus the $400 to $500 for the moving parts part of that.
Mhm.
I know that's a discrepancy into cost when people are like, well, why wouldn't I do that versus the other? There comes into play what it's going to cover. If you want to stay in network, if you want your own doctors, a lot of them may or may not be in network on their Advantage plan. When I did a supplement plan for a client several years ago, her doctor, or I'm sorry, her hospital wasn't under the Medicare Advantage plan that she wanted. So we ended up doing the original Medicare with the a la carte plan, because a lot of either providers or hospitals may have not been involved in the Medicare Advantage plan. So there's some things to really evaluate. It's not just a dollars or cents situation
Right.
sometimes. You really have to see what's going to be involved. Moving and changing doctors definitely is a little
Mhm.
bit of a challenge sometimes. But if you were to think about the pros and cons, if your original Medicare, kind of the pros are, you have a flexibility of your hospitals and doctors, like I was explaining before with one of my clients. You can pick and choose coverage.
Mhm.
For that, it is portable, so you can take it from one place to the other. You don't need to make any changes if you move service areas, perhaps, but it is fairly portable. The cons is, of course, that 80-20 split, unless Medicare supplement is purchased with the original Medicare. More coverage does equal higher premiums. Like I said, you'll have a base model plan A for your supplement, and then you may have a top of the line one. So that could be a little bit higher premium. As it stands now, there's no dental, but hopefully that's coming down the pike with the original Medicare. Now, some of the pros and cons of Medicare Advantage is that the pros is basically the kind of the bundled version. All healthcare is in one bundled package. Some of them do include a dental vision, could be included in some of the Advantage plan. Some of the other niceties, like I said, which are silver sneakers for healthcare. I'm sorry, health gym memberships,
Mhm.
things like that could be covered. Out-of-pocket maximums could be included as well, so you don't have all of the kind of catastrophic involved with that. Now, some of the cons, as I mentioned before, like with this particular client, is that doctors or hospitals have to be in network. There could be some that are out of network, and then you would have to pay additional costs for anything that's out of pocket costs as it relates to moving out of network. So you want to do that. Some of the plans could limit it to a PPO or HMO network. So that could be a little bit higher premium for that for the Advantage plan. So limited to what the plan could allow based on what you're going to be paying for out of pocket or out of network on that.
Mhm.
So, that's why I said it's not the whole dollars and cents situation. Sometimes you do have to evaluate the cost of what original Medicare would be for premiums, and the same thing with Advantage, and then some of the pros and cons that are available in each of those particular models.
Mhm. Well, that's a lot to think about, but
Exactly.
hopefully people that are challenged can find professionals, financial advisors like yourself that will help them to make a smart decision.
Exactly. Yeah. Yeah. That's what it comes down to is, really evaluating. I do um, Medicare enroll or basically Medicare analysis reviews with clients that I do work with. Really because, keep the costs down, but then also making sure you're not going um, to pay more than you have to, how you integrate your Part B premium from what you take out of your retirement accounts to try to keep that. Basically how your withdrawals from your IRAs are going to affect your Part B premiums, and try to adjust accordingly
Mhm.
on that. So everything is kind of intertwined when you're thinking about your whole retirement scenario, and Medicare is one of those that I take a look at for my clients as well.
All right. Well, point number 9 on your list is enrollment.
Mhm.
At the
Yeah.
beginning, I talked about that we have a time of year every year that we are supposed to enroll, but some parts are not limited by the enrollment dates, I believe, but maybe that's only on years when you're first starting up. I'll let you talk about enrollment.
Yeah, exactly. So you're going to have the initial enrollment period. That's when you first age into Medicare, when you first become eligible, which is age 65, as I mentioned before. If you are receiving Social Security, you're automatically going to be enrolled into Medicare at age 65 if you are already receiving Social Security. So nothing to do there. If you are not receiving Social Security, there is a 7-month enrollment window from when you age into Medicare. So let's say your 65th birth month plus 3 months before and then 3 months after. So 7 months is the
Mhm.
enrollment period when you first, what they call the initial enrollment period when you age into Medicare. So that's 7 months. If enrollment deadline is missed, I mentioned some penalties that are involved. You must wait until general enrollment period, which is generally January 1st through March 31st of each year. So if you didn't enroll in that 7-month period, you could have a little bit of a penalty for not signing up for Medicare when you needed to, which is generally just your Part B and your Part D
Mhm.
premiums would be affected with the penalty. And that is, like I said, a lifelong penalty. It's not just a one-time penalty. Your premiums are going to be basically increased to include that penalty if you miss that initial period window. Now, a common question I get a lot of times is, Pam, do I need to sign up for Medicare if I'm currently working? The answer is no, because if you're currently still working, you're under your what they call a qualified health care plan through your employer. This only has to deal with when you separate service and you're as a retiree and you are no longer covered under an eligible plan, then this is where, and then you get that initial enrollment period again. So even if you, let's say you retire from your employer at age and you come off of what they call credible coverage, and you're 67, same thing. Once you get in, you at that particular period of time, what will happen is you get a special enrollment period when you come off of coverage, and that's generally 8-month window after your
Okay.
employment end. So if you're covered, like I said, under a group plan, you can sign up for Part A and or B upon retirement, and then you get that 8-month window after employment ends. Your group coverage, once your qualified group coverage is lost.
Mhm.
And then COBRA and your retirement plans do not count as what they call credible coverage or qualified coverage. So instead of 7 months, from the initial enrollment period, you get 8 months when you separate service from your employer, and then your program is no longer valid. You get a little bit more time to get into a plan, either sticking with original Medicare and paying the Part B, Part D, A for free premium and or enroll in an Advantage plan.
All right. Now, the last thing we need to talk about is any changes that have happened that will take effect on January 1st of 2022.
Yeah. Well, before that, let me talk a little bit about the Medicare supplement enrollment.
Okay.
I think I talked about it a little bit before, alluded to it before, but you get that one-time 6-month Medicare supplement initial enrollment period. So starts the first month, you're 65 and enrolled in Part B. You do have to be enrolled in Part B to get the supplement. So you get that 6-month window period. Anything after that and it closes, you could be eligible or subject to underwriting. So you get that 6 months window from there. The prescription drug enrollment during the initial enrollment period, you get that 7 months window. You can change the plan during where we are now, basically October 15th to December 7th. And then if you subscribe to a prescription drug program after the eligible enrollment period, you are basically penalized at 1% of the national base premium for the month of the number of months that you had without coverage. So that's that penalty that's built into that. So you don't want that that time period. Let's see. So during the open enrollment period between now, basically October 15th to December 7th, you can basically go from original Medicare to Medicare Advantage. If you decide you didn't want that, you wanted the bundled, you can go from an Advantage plan back to original Medicare if you need to do that. You can go from Medicare Advantage plan to another Medicare Advantage plan. And you can also change from your Part D premium, Part D prescription drug plan to another one. So those are some of the things that you can do during this particular time period when open enrollment is occurring. So some of the changes right now, for the most part, cosmetic changes. The vast majority of people do not have to pay for but if you did not pay enough into Social Security tax while you work, the premium, you can get it. You do have to pay for it at that point. It just went from $252 to more like $458 per month. So they did increase that a little bit. The deductible has increased a little bit for the hospitalization for Part A. That's $1,408. It went down a little bit. The co-insurance has gone up just a little bit. And then the skilled nursing care, the first 20 days, you have $167 per day co-insurance for days 21 through 100. And that's the thing about Medicare. A lot of times I get the question is that, I don't need long-term care. Medicare's going to cover it. Medicare does not cover long-term care. It covers skilled nursing facility care for about 100 days, and then that's it. So when my mom was we looked at getting her care in an assisted living facility. We used that 100 days, had Medicare pay for it, and then after that, everything is out of pocket. She did qualify for Medicaid at this point, but long-term care is not going to be covered through Medicare. Skilled nursing facilities, 100 days for that, and then that's it. You get there. There are some Part B premium changes a little bit. The lowest is $145 a month. Again, it's going to depend on what your adjusted gross income is. That's just kind of the base premium if you're kind of in a lower tax bracket for that. And then the deductible. You do have a Part B deductible that I forgot to mention. That's about $212 per year. So you're going to have a Part B premium based on your adjusted gross income, but you also have a Part B deductible that you have to pay before Medicare will kick in for any of your doctors for that. The main things that really have changed for it is that the coverage changes was expanding telehealth coverage. We've been in this pandemic for the last 20 months or so. And so remote medical care has become kind of more of the norm. And Medicare wasn't really into that at any point in time, but now they have expanded telehealth coverage for remote health medical care using internet. family doctors, cardiologists, endocrinologists, psychiatrists. So they're getting into a little bit into the mental health part of that. And then patients with end-stage renal disease must be allowed to enroll in Medicare Advantage plan. Before, that was one of the things that took people out of being eligible for Medicare, is if you had end-stage renal disease. But now they've opened it up to those particular people who have that now through a Medicare Advantage plan. So other than, it's kind of some premiums changes and adjustments, those are the kind of the two big things that have really changed, is expanding the telehealth and then also providing that end stage renal disease, people who have that eligible now for Medicare.
All right. Well, then it looks like you've pretty much covered the basic things, and I certainly am happy to know that telehealth is now covered, because
Yeah.
I think that will help a lot of people. So
Yeah, especially older retirees or older people who were still kind of in this pandemic situation, is people are still not comfortable with going out of the household, and having access to telehealth and having it being covered through Medicare is big for that. So I think they realized that a lot more than what they had before, especially everybody was, I think the last time I've actually physically went to the doctor is a couple of times. Before that, they're scheduling virtual visits and saying, unless it's an emergency, let's hop on. They'll talk it through. If they need to see you, they'll tell you to come in. But other than that, I think a lot of the doctors are going virtual as well, unless it's an emergency.
All right. Well, thank you again. You've just really helped a lot of us who've been confused by all the ins and outs of Medicare. And as usual, it's always great talking to you, because you are such a fountain of excellent information. So thank you for being my guest and for providing this excellent review of what Medicare looks like for 2022. I look forward to our next discussion, which our November call. Normally we meet on the fourth Thursday of the month.
I think it's Thanksgiving.
Yes. So I don't think we're going to be doing Thanksgiving November 25th.
Probably not that. Maybe the week before.
Yeah, you and I will probably go for the third week, but we'll get back to everybody with what that is when you and I have confirmed that.
Yes.
Now, I suppose I'm starting to see flu shot availability, and I know that some people are kind of confused about flu shots and COVID, but I still think that the medical community is trying to tell us that getting a flu shot is more important than ever. So for all of us people listening here today, I believe flu shots are covered by Medicare. So that would be something that we should not forget to do. Is there anything else that you would like to say before we wrap up this call, Pam?
Nope. I mean, I know we went through a lot, and so I know you generally give my information out if you had any additional questions, because it could be a little bit of confusion, especially when there's so many moving parts. Pun intended, so many moving parts to Medicare, right? That people just don't have the resources for that, and so I just want to really encourage people to adhere to the deadlines and the enrollment. If you do need help, definitely seek help, either through myself or your financial advisor or other professionals, because if you make one mistake in this particular situation, it could cost you a lot more by not having the proper information and then missing some deadlines in enrollment. So definitely make sure you get seek help.
I am going to tell people here in a second about how they can get in touch with you. And I want to also share what I think it was on Facebook that I discovered recently, Pam, that your logo that you have for Jackson Sam's is a swan. And I always thought that was just because swans were cool, but I found out that it's an acronym for Sleep Well at Night. So if people need to worry about being able to sleep well, they should be able to call you, contact your website, but email you at Pamela@jacksonsams.com. That's PAMELA JACKSONSAMS.com, or
Mhm.
go to your website, jacksonsams.com. People who are listening can also look to Medicare.gov/blog or mymedicare.gov. I believe those are still
Mhm. Yes.
good
Mhm.
web addresses for help. So we want to make sure we don't forget that. And if you'd like to know more about the National Association of Baby Boomer Women, our website, of course, is www.nabbw.com. And we have a Facebook page at facebook.com/nabbw. One of the things about the Facebook page, why I try to mention it every month, is because anything that comes up new about a topic that we've recently discussed, you and I,
Mhm.
Pam, I try to post that to the Facebook page. So recently, I
Yes.
think I posted some stuff about Bitcoin, because a few 5 or 6
Yes.
months ago, it seems like we
Yeah.
talked about that.
Exactly.
So I don't know if people care about Bitcoin right now, but if you're looking for any information that I come across that you haven't seen on Pam's website or and the Medicare website, check the Facebook page at facebook.com/NABBW for anything that I find. Not that I'm as good at finding these things as Pam, but anything that I find. And Pam, you have some information that you're going to share with me that I'm going to put up there.
Yes, yes, it's a white paper on Medicare enrollment and things like that. I think it'll complement nicely to the call, and so I will be providing that fairly soon, so people will have
Okay.
access to that white paper.
All right. That sounds great. Thanks for joining us, everyone, tonight. And actually, right now it's this afternoon, but joining us, whatever time of day it is for you,
Yes.
we appreciate that you're here. Thank you so much. And especially thank you to you, Pam.
All right. Thank you very much for having me once again, and I enjoyed the conversation, because I think it's one of those necessary phone calls or information pieces that most people need to know about, especially during this time of the year. So I appreciate the opportunity to share.
All right. Well, we thank you too. Thanks so much, everybody. Bye now.
All right. Bye-bye.